Hi, I'm Claudia St. I'm the president of Affinity HR Group. We are your HR partner and resource. We're also your resource during this COVID epidemic or pandemic, and have been working very hard the past month trying to get the information to you when you need it as we all prepare for this pandemic. Unfortunately, we now are seeing a change in the inquiries that we've been getting from clients, and rather than preparing for the eventuality of perhaps an exposure at work, we are now responding to those exposures. So increasingly, a lot of employers are calling because their employees or a close associate of their employees have been sick and potentially have exposed the workplace. So here's pretty much what you need to do. Now, of course, there's no one size fits all for everybody. So there's a lot of discretion here, but this is the advice that we are recommending to the cases that we're dealing with. The first is to make sure that employees know what the symptoms are of COVID. The CDC has the Centers for Disease Control has a very robust site for employers about what to notify employees about, the different symptoms, what yours should do if an employee shows up sick. So the first is to recognize what are the symptoms. Make sure that you communicate that with all of your employees and that you start practicing right now social distancing and safe workplace hygiene. In addition to posting those posters out with how to wash your hands and to cover your sneeze and your cough, make sure that is sent to everybody. If there is anyone at work right now who can do their work from home, they should be sent home now. Better to send them home now before they have to be sent home than when it's too late and they're not prepared to work from home. If an employee shows up sick or calls in sick, you may inquire whether they are sick with the potential symptoms of COVID. If they are, send them home, ask them to reach out to their medical provider. Again, following the symptoms of the CDC guideline. Many employers have been asking us whether they may take their employees' temperatures or require that they take a COVID test. The Equal Opportunity Employment Commission, the EEOC, has provided guidance on this. A coronavirus test, first of all, while very, very hard to come by, is a medical procedure, and you cannot require that somebody take a test unless the nature of your workplace specifically requires it, such as working as a healthcare provider or for a nursing home. Most of our clients don't fall into that category. So requiring a test is a bit of a gray area. But the EEOC has said that you can take the temperatures of all of your employees before work. And when I say all of your employees, it's important not to discriminate against any particular type of employee. So if you're going to test an employee, you need to test all of them on an ongoing basis. And anybody who shows a fever should be sent home. I want to remind people that the value of doing this kind of testing is relatively minimal because fever reducers can eliminate a fever, and they're saying now up to 50% of people with COVID do not have any symptoms whatsoever. So simply taking temperatures is no means a preventative measure. What is a preventative measure is to practice social distancing, keeping your workplaces as clean in terms of hygiene and cleaning supplies as possible, and sending absolutely everybody home who can be sent home. If an employee shows up sick, what do you do? Well, first of all, send them home. If somebody is suspected of being sick or has been confirmed to have COVID, you should notify all employees who've had close contact with that employee. And by close contact, meaning working within 6 feet or less of that person on an ongoing basis. So a close associate, simply walking through the lobby or nodding to a receptionist may not be sufficiently close to warrant a quarantine. But those folks who do work closely with that individual, I would notify them that there has been a potential exposure. Do not share with those employees who it is that is sick. It's important to keep the privacy of the individual who's been exposed as confidential as possible. Now, of course, if you're in a workplace that has 4 employees and 3 of you are standing there, they're going to know who that other employee is. But except in instances like that, let employees know calmly and reassuringly that there has been an exposure, where physically the exposure has been, and allowing people, if they need to quarantine, to do so. Now, if they are required to quarantine by a healthcare provider or a public entity, such as your public health commissioner, then they would be covered under the Sick Leave Act, the Emergency Sick Leave Act, part of the Families First Coronavirus Response Act. If not, and you're simply doing it on your own, I would strongly encourage you to consider covering some part or all of the quarantine, stay-at-home quarantine that you essentially are putting on those employees. Now, I just got a call from somebody. They found out that an employee had COVID, but he tested positive just recently, but he hasn't been in the office for over 12 days. Well, we know that the symptoms of COVID show up usually within the 14 days. That's why all quarantines or stay-at-home orders for exposure are 14 days. So you want to make sure in that instance you notify employees that they may have been exposed, but the exposure was 12 days ago, and unless they've shown symptoms, that they should just keep an eye out. So this is the difference between sending people home and letting them stay. It's the nature of the exposure. How long ago was it? Was it an actual COVID, or was it somebody who just potentially had COVID? So this is the gray area. And if you have any help or need any help in sort of crafting your response, please reach out to us because we are here to help. Once you've had an exposure, the Occupational Safety Health Associate Organization within the Department of Labor, OSHA has provided lots of guidelines on how to clean your office. You should leave it, if possible, closed for 24 hours and then start cleaning after a rest period of 24 hours by also opening windows, doors, and increasing ventilation. If you have a janitorial sector business that has been cleaning your workplace, make sure you notify them, because they may be equipped or they may not be equipped in order to help you remediate that workplace contamination. And you want to make sure you keep those workers as safe as possible so that they know the risks when they come to work. Finally, when it comes time for having them come back, well, before that actually, there are forms out there now for people taking the mandatory paid sick leave, emergency sick leave, for them to fill out those forms, providing the documentation and the release dates for taking that leave. So you might want to consider implementing one of those. And finally, when it comes to returning to work, the CDC has said, and these have been changing, so you need to keep track as all of this changes as it goes along. You should not allow anybody back to work until at least 3 days or 72 hours that they have been fever-free without the use of any fever reducers. So 3 days after they are no longer having a fever, and there has been a significant improvement in their respiratory condition. So they're breathing better, they're not coughing so much, that they are back to a stronger level of health, again, without that fever reducer. If they have been, and no less than 7 days from the onset of the first symptom. So even if they're feeling better after 2 or 3 days, you want to wait that full 7 days before you have them come back to work. If the individual was tested, not many are being tested, but if you had an individual who's tested and tested positive for COVID, in addition to being fever-free for 72 hours and to have improved respiratory condition, you also want to have them take another test to prove that they are negative. And those tests, according to the CDC, you should take no fewer than 2 tests in no less than 24 hours. So have them at least 24 hours spaced apart, showing 2 consecutive negative tests. Again, that's a lot of testing, and a lot of folks aren't being tested, but just some ideas for you. So right now, I would recommend that you get those forms together. You practice that social distancing. You make sure you've already identified a cleaning service that can help you come in and clean up your workplace in case you have a contamination. Make sure your employees know that you are there for them, you are keeping their medical conditions confidential, and that you're looking out for their best interest and the best interest of all of your employees. So we're answering more and more and more of these calls as we get them every day. So if you do have a contamination and need some help, we're offering a new Corona support plan. It's just a prepaid hour for us to help you answer your questions as we go along. We always will continue to provide information to you, but we wanted to make sure you had what you needed in order to deal with, unfortunately, the likelihood of having a contamination at your workplace. I hope this helps. I hope that you have a safe and productive work week, and know that this is a brief moment in time, and it too shall pass, and we will come back to better business days ahead. All the best to you and yours. Take care.